Hi, my name is Jamie Gill. I work as a registered nurse at a local community hospital, and it's my honor to stand before you, the House, today to represent the American Nurses Association, which is a leading professional organization representing the common interests of over 3 million registered nurses throughout the country. We work together to advance the nursing profession by fostering high standards of nursing practice, promoting the rights of nurses in the workplace, projecting a positive and realistic view of nursing, and by lobbying Congress and regulatory agencies on issues that affect nursing and the public health as a whole. I'm here representing the ANA today to discuss the critical topic of nurse-patient ratios and the impact that these ratios have on healthcare as a whole, and the fundamental importance of supporting national legislation on these ratios. And while modern nursing is complex, multifaceted, fast-moving, and multi-focused, the overall goal has remained the same since the time of Florence Nightingale, and that is to provide a safe and caring environment that promotes patient health and well-being. There's a fundamental relationship between providing that safe, caring environment and having a safe number of patients in which to care for. Right now, we have limited legislation on exactly what those numbers should be. We have in place right now, we have a regulation that states hospitals certified to participate in Medicare must have adequate numbers of licensed registered nurses, licensed practical nurses, and other personnel to provide nursing care to all patients as needed. While this is a nice way to start things off, this should not be the end of it. This should be the beginning. There's a great deal of ambiguity as to what adequate staffing is, and each facility and state is left up to their own devices to determine exactly what adequate is. And we really need to have some national regulations in place that hold each facility accountable to providing a safe number for both patients and staff. There was a survey that was done of over 200,000 nurses in over 500 different hospitals throughout the country that had a common theme of reporting staffing shortages leading to mandatory overtime, decreased quality of patient care, nurse burnout, and a direct negative effect on admissions and discharges. So because of this information and because of the negative effects of the staffing shortages, we're suggesting that every hospital be required to have a nurse-driven staffing committee with a focus on creating staffing plans that reflect the needs of the patient population and staffing qualifications for each unit. Because of the high number of variable factors, such as patient acuity, nurse skills and experience, the amount of support staff that's available, and the technology that's available, we are not suggesting a national standard number exist. We don't think that would be in the best interest of the patients or the staff. So we are suggesting that each hospital and each unit within each hospital has their own committee that determines exactly what is safe, and that they're held accountable that these numbers are accurate and that these are safe numbers that they're coming up with. And this is going to benefit everyone. This isn't just something to help the nurses out. This is really to help the patients. Each additional patient care registered nurse will generate over $60,000 annually in reduced medical costs and improved productivity. There's also other intangibles like the reduced pain and suffering that the patients will experience because they'll have better nursing care because the nurse will have more time to tend to them and be more quick to respond to their needs. There will be a lower risk of patient readmission because there will be higher quality of admission and discharge and care throughout the hospitalization. And this is going to lead to improved hospital reputation because if you have better care in the hospital, that word is going to get out that you are providing better care. And when you have when the nurse has less patients to see, she is able to provide better care to each individual patient that she does have, which is also going to, in turn, help lead to reduced malpractice claims because of that better rapport that the nurse is going to be able to build with the patient, along with actual better care because she's going to have more time to be more in tune to the more subtle changes and maybe prevent something before it gets so bad. There's also going to be improved work environment, which is going to result in reduced turnover and lower risk of injury for both patient and staff. When you're not running around like crazy, you're less likely to injure yourself, and your patients are less likely to have falls if you're more attentive to their needs and you're going in to see them more often because you have less patients to oversee. And studies have shown that there is a direct correlation between higher qualified staffing numbers and lower rates of patient outcomes. So as you can see, these benefits really help everyone. They help the hospitals, the Medicare, the nurses, and most importantly, they help the patients. So the patients are really going to be coming out on top in the end of this, which is everyone. So it could be you, it could be me someday. You don't know. It could be your family member. So basically what I want to say here is that the nurse-patient ratio legislation is not something to be ignored. It's something that needs to be enacted sooner rather than later. And it's going to benefit both the patient and the healthcare worker and the healthcare field as a whole, because patients are going to have better outcomes. Nurses are going to have better job satisfaction, lower turnover, decreased burnout, and the quality of nursing care is going to rise, which is a vital aspect to our overall healthcare as a whole. Like I said, there are over 3 million of us that are working, and we all want to provide the best care possible, and we are asking that you provide this legislation in order for us to better be able to do that. Now, when you're thinking about this, maybe think about if it was you or your family member that is in the hospital receiving care from a nurse that's overburdened with too many patients, as opposed to a nurse that has the appropriate amount of workload, and try and think about which nurse you would rather have seeing you or your mom or dad. So I'd ask you to think about this, and I thank you for your time today and appreciate your listening. Thank you.